welcome back to another new edition of Windows and Current Affairs. And today is a very, very special topic. I'm full of hope that you are going to be enjoying every moment of it, because we have a very interesting caliber with us here, an Egyptian young woman amongst youth, a very important youth element, and also she is advocating for youth volunteering, preparing youth to be the future leaders in different ways. Not only the typical ways that we have always seen, always witnessed, no, but in other sectors in society, especially in the health sector, which caught our attention also, and this is why she is here. Those people have been giving hands, volunteering on one of the most critical stages in history, at the time of COVID, and other times also, stretching hands in the health sector, volunteering and doing wonderful things, amazing jobs. We're very delighted to be having with us here live in the studio Ayat, Mohamed, Ibrahim, and she's a coordinator amongst to advocate for youth volunteering. That's how far I have been putting it to. She's going to be explaining to us more about what she's trying to do in Egyptian society, she and her counterparts also. Good evening, Ayat.
Good evening.
I'm very proud of you.
Thank you. Actually, we are very lucky to have this opportunity to describe ourselves and to make people explore how nursing are going on this country.
Before we talk about or delve into our topic, I just want you to introduce yourself to the viewers. I just introduced you generally, but seems that you have a lot to say about yourself.
I'm Ayat. I was just graduated from nursing school here in Egypt, in Ain Shams University. And then we started in 2009 our association. Actually, it was NGO, and it has that many branches. We had 17, and now we are going to have 19 branches all over the country. Each branch in university, it has a nursing school or a nursing college, of course.
Can I ask you a question? Sure. If you like to complete.
So we are that group of nurses who decided to have a better future. So as you might notice that we don't have that second line people for nursing, but we always have those big calibers in medical schools and these big figures. And what we need to do is to have the second line from leaders, from youth, from nurses, so they can have the vision and mission for the future and deliver there.
Okay. So can I ask a question in here? Only females or males? That's a very important element.
It's very well known that nurses here, especially in Egypt, are females. But
very few are males.
Like it's 80 to 95. That's the maximum. This is not the accurate numbers, but actually now we are in this way to have more male nurses, and even the demand for male nurses are very accelerating.
So you are empowering also male nurses?
Yes, that's true. So it's just
an association that is gathering males and female nurses.
So our name is INSA, which is the Egyptian Nursing, Novice and the Students Scientific Association. It was founded in 2009, and then it was just conference, and then we launched it. After many years, now we have this approval from many governments all over the world. We have that cooperation between us and an NGO here in Egypt and many other associations like the WHO, the UNICEF, and some of the national some of the national initiatives, as well as the congresses here in Egypt.
Right. I'm also amazed at your good command of English. So
that's another part of our mission and vision. We always see nurses should have a better future. And one of our elements and goals to have preparation for the nurses to be willing and ready for the workplace and to be ready for the market. And now it's not like before. The nurses not just do the normal things as we used to have in our Egyptian hospitals. But now we are giving them the opportunity to go see some other nurses in other associations in other countries, and to have some courses. Most of those courses are for free. So we had that collaboration and cooperation between us and between some of universities in UK, some volunteers in the US. We have some online schools to delegate with. Also, we have some online programs, and because of the social distancing and the internet and everything is online right now, so it's easier and it's cheaper to go to anything in the WHO website or in one of our providers for the healthcare trainings. And now we give the nursing students also the American Heart Association certificates in the BLS, the basic life support, as well as the advanced life support too. So those are things that it's very expensive. You just want to take them outside, like in the US or the UK. But here in Egypt, we are trying to make most of things are for free.
Amazing, but we need also to take a wider look over that particular initiative, not only about, with all the respect of, and admiration to that the nurses sector or the nursing sector, but also as an initiative in general for youth and youth volunteering. As we all know that other volunteers also are considered as nurses. They are medical assistants, and especially at time of crisis, and especially at time of when there is a pinnacle or peak at pandemics, and we have seen how that have saved Egypt on many fronts, not only medical assistance, but spreading awareness, but giving assistance, hygiene assistance, giving sanitizers, and all these fronts have helped Egypt not to delve into that very dark tunnel that other developed countries have went into. So I want you to talk to me about the youth volunteering in general. And how important is it, and how far have you worked, people, on empowering that particular spirit inside you and your counterparts to be able to serve society?
So in INSA, we believe that if you don't have a mission in your life, you don't deserve this life. And all our members in that association make everything. They put the heart and soul on such times. It was really hard time for us, nurses and medical providers, to see that waves of COVID. So regarding this, we had initiative with the WHO regarding the mental health and psychological support. We delivered 7,000 training for nurses about the psychological support in the COVID pandemic. Also, we delivered our messages and we delivered our care and our psychological support to nurses among the hospitals. We had some statistics here that I will put you later on. So that statistics was talking about our service, which was delivered via WhatsApp, via calls, and via other means of communication. We helped many nurses from Egypt as well as from other countries like Philippines and US.
So you're open to other nationalities?
Yes, and open to other occupation too. So we helped some doctors, and we had that network of psychiatrists, so we can make some referrals too. So it was really well done and well cooperative work from all the healthcare providers worked with us.
Right. Talk to me about your program. Probably something massive like that would involve awareness at the forefront.
Yeah, that's
true. Step one is awareness, because we are at a time, awareness is a must that should be provided to all sectors in society, especially at informal sectors and low-income brackets and illiterate and elderly people, youngsters, and I mean those sectors in society. How did the idea spark to you?
So actually we have some segregations in the community. So we have target groups, and each group of this community deserve a special and specific message. So we're talking to a kid like elementary school. It's not like what we talk to about a geriatric or a retired woman or man. So regarding this, we have those 17 branches among the Republic of Egypt, and we have those programs regarding each category of this. So we all have that strategic plan in INSA, who we always put them together, and we always have that communication to see what are the people in need, who are the people vulnerable to what's going on in the country, especially now with the Sustainable Development Goals and the vision, the Egyptian vision.
The 2030 vision?
Exactly. So we are cooperating with this with many national and international places, and to be inspired from this vision, to have our vision in INSA, to be cooperative and collaborated parallel to 2030 vision too. Also, during COVID, we went to schools, we went online to do some stuff, some online trainings, some online awareness. We went to small villages, just deliver our messages about how to prevent and how to be healthy and stay healthy during the pandemic.
So you had volunteers, different youth volunteers, from all walks of life.
Yeah, that's true.
I could come over and volunteer
Of
with.
course, we will have you in the media come here.
So media, engineers or anybody.
Most of us are nurses, but sometimes we need some help from professionals like you. And I'll be very honored to have you in our INSA group for communication and media. The thing is, we know that we are particularly specialized in nursing, in healthcare education, but we're not that big fans of doing others' job. And of course, with this era where specialty is a main thing to shoot the stars, as they say. So most of us are nurses. Sometimes we need help from others. Sometimes we get volunteers and ask for help. Anybody can come. And actually, we just launched our new INSA. And now any nurses from the public sector, from the private sector, any nurse, any Egyptian nurse can join us and help us to do our vision and mission and to make our nurses' future better.
As an Egyptian young woman and a lady like you, very representable, and your rhetoric even. Rhetoric is very important that I've noticed. You're very representable when you speak about your initiative. I can imagine going abroad, going to the United Kingdom or the United States of America and representing yourself as an Egyptian young woman. You must have had an impression. You have impressed people. I mean, what were the reflections when you were talking about your initiative, when you went abroad?
So actually, not only me, but we have so many colleagues who went abroad and then come back with the impressive people. And then those impressive people, they just came and know us more, and then they start the cooperation. We are very lucky to have the support from the WHO, from the EMRO,
okay,
yes.
the United States.
EMRO is the regional office for the WHO. We was very delightful to have the partnership with many organizations. We are part of GISN, which is the Global Nursing Association. We took the vice president chair in this association. We are part of the Global Nursing Network. We have many other initiatives. We are part of it. We have many colleagues in INSA who went and represent the youth nurses here in Egypt. And to take those chairs, it was really hard. Just, it's like when you have some elections. It's really hard to have some loops and to have some communication with others, especially with those big countries like Canada, Spain, and Mexico, those big countries, especially in the healthcare sector. You feel you're very, very proud. And especially when I travel outside Egypt as a woman, I feel like people are very impressed. Having a woman from Egypt alone and she's not covered, that's for them, that's not the picture they always have in their minds, especially if she is a nurse. So it's a bit, it makes me so proud of what I'm doing and what we do here in Egypt and in so.
But then The idea would reflect a lot of meanings, this initiative, not only about nurses in particular, but about young women who have a passion to help society and serve it in a totally different way, volunteer and excel in that job, and also gather other professionals, and also at the same time upgrade the cultural backgrounds of some sectors in society, like nurses, like other sectors, like other professions. This is a very hefty job.
Yeah, that's true.
How do you do it?
Actually, we coordinate. We are very, very organized organization. From day one, we have strategic plans, and now we are modifying the strategic plans, as I told you, regarding the 2030 vision, here for Egypt and for the international community. We have some, let's say it's some committees for other things, like the media. We have a committee for marketing. We have committee for nursing education and training. We have a committee for the public health. So I'm not the only person there. We have Ahmed Gamal, and we have Ale, and we have so many names. And actually,
what are you in charge of?
So I'm in charge of well, not in charge of. We're just a team. I'm just a coordinator for the international task force, and I'm not alone. We have we have 6 or 7 people, and now we are trying our new program about if you want to travel and to be a travel nurse, or travel to abroad for another country, or learn a language so you can build your career outside Egypt. That's one of our programs. So
what exactly do you advise youth to do?
Generally, or in nursing sector?
Generally.
So generally, you should have a vision and mission.
Of course.
Something you
Like
pursue, something you're chasing to have, and that makes life taste better. And if you're having that rule in your community, in your life, between your colleagues, you'll feel like you're very special, because that makes you unforgettable. The thing about us in INSA is, if you just meet anybody of us, you will never forget him or her, because we have that vision, that passion, who deliver our message. Not only, it's not about the tone, it's about how do we believe in this message. So it's not about volunteering by money. It's a volunteering by
effort, by spirit,
by your skills,
by vision.
Just learn something else, teach somebody else. And there is a workshop that I have been a member of. That was 2010, I think. And I had that quote: each one teach one, each one reach one. So teach one, and each one can teach one. And only by you giving that message to another person, that makes people are just, it's like a tree. The more people you deliver the message to, the more we're gonna be. So just have 5 minutes, just help a blind person, just do something good for people, and just help cleaning your house. And there are some quotes about just make your bed, please help people. That's the very step to do things for others.
Actually, we're running out of time, but I just wanted to ask you something also that might be of a good value to people who are watching us right now. Like talking about, listening to you, I can see it's all about awareness and cultural background. It's very obvious. You're such an aware person. We only have like 1 minute left. Talk to us about how important awareness is for the 2030 vision.
So recently we had the UNAIDS in Egypt, and actually it's one of our stakeholders, and we had that school workshop about AIDS and the community engagement and the importance of awareness. So we are doing so many campaigns regarding UNAIDS, with UNAIDS, helping people. Like now in Egypt we have 16,000 HIV positive cases. And that means we need people to be aware of the drug substance, the sexual habits, how people can induce drug in their systems, and just be an HIV person. That's one of how important is it to be aware and to make that awareness. Especially this is one of the main goals for the Sustainable Development in 2030. So that's one of our plans to do with the Ministry of Health, the NAB, the National Program for AIDS, and the strategic program for Egypt for 2030.
And because of awareness, like I said, this number is definitely on the decrease, is inclining, as according to the statements by the Ministry of Health, of course, it's on the decrease. I can't thank you enough. I'm very impressed. I'm supposed to be objective. But we're very proud in general with women like you. I'm going to leave you now because we already ran out of time, on a promise that we could have you once again. Thank you so much.
Thank you.
Mohamed Ibrahim, of course, from the Egyptian Volunteers Initiative. Thank you so much and wish you all the best. Thank you for coming. And I guess this would bring us to the end of Windows on Current Affairs. Many thanks to all of you. Until we see you again next week, that's a goodbye.